Welcome to Healthy Living, brought to you by Novant Health. I'm Robyn Zimmerman. Comprised of Coastal Carolina Medical Center, Hilton Head Medical Center, the Bluffton Medical Campus, the Bluffton Okeechobee Outpatient Center, the Tidewatch Emergency Department, and the new Beaufort Multi-Specialty Clinic, Novant Health is dedicated to providing the local community with compassionate, quality, extraordinary care close to home. Let's begin our program with a few health headlines. Well, the month of May is Women's Health Month and serves as a reminder to take care of your overall health and make it a priority in your life. This includes seeking medical help when you need it, but it also involves engaging in preventative care to keep you healthy, like scheduling checkups, examinations, vaccinations, living a healthy lifestyle, and more. Women's Health Month also acts as an opportunity to educate women on the most common risks to their health, the symptoms, the warning signs, and when they should seek medical attention, so they know when something is out of the ordinary. Now, here are some of the most important health concerns that women should consider. Breast cancer is the second most common type of cancer in women in the United States, with nearly 250,000 new cases each year. Cervical cancer. There are over 300,000 women living with cervical cancer in the U.S., with around 14,000 new cases being diagnosed each year. Then there's ovarian cancer. There are around 19,000 new cases of ovarian cancer diagnosed in the U.S. each year. What about physical activity? Did you know that more than 60% of women in the U.S. do not engage in the recommended amount of physical activity? Now, this can lead to other health issues like obesity, weak muscles and bones, hypertension, cardiovascular disease, and more. Osteoporosis is a disease that thins and weakens the bones, reducing bone density. Osteoporosis is more common in women than it is in men. And then finally, cardiovascular disease is the leading cause of death among women in the United States, resulting in nearly 300,000 deaths each year, the equivalent of 1 out of every 5 deaths in women. And every 40 seconds, someone in the United States has a stroke. Around 800,000 people will have a stroke in the United States this year alone. A stroke is a blood vessel blockage going to the brain. And a stroke is the third leading cause of death in the United States and can lead to significant disability. If you suspect a loved one may be having a stroke, or you realize that something about them suddenly seems off, this is the time to react. Remember, calling 911 is the right thing to do. Calling 911 and getting EMS care could have a lasting impact on a loved one. Signs and symptoms can be subtle and easily missed. Now, if something seems wrong, it's vital to react quickly. More people in the U.S. have strokes than heart attacks. For more information on all of these stories and this health information, please visit the website at novanthealth.org to find a physician and for more information on Novant's programs, services, and locations. Coming up after the break, we'll continue with this edition of Healthy Living with interviews from Novant's physicians and staff. Don't go away.